You're watching The Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know if you're considering liposuction. My first guest is an expert on the topic, Dr. Jeffery Klein. Dr. Klein, welcome to the program.
Thank you.
All right, now before we get into today's topic, very interesting background training, because you're a board-certified dermatologist,
Right.
but you do all types of, what, cosmetic dermatology, a mixture of both?
I started out doing a lot of cosmetic surgery, but now I limit my practice to liposuction and
Really?
some general dermatology.
Okay, and is that rare, by the way? Because look, our show airs throughout the United States and Canada, and I've only met two people. We said this off camera that like to do lipo. I mean, is that true? Do you find
I
that?
really enjoy it.
But a lot of guys don't like it.
I enjoy it. I think it's an art, and it takes a lot of finesse.
Okay.
And I think the general perception is that it doesn't take much finesse, and it's a self-fulfilling prophecy. If you think that, that's what happens.
Now, the pretty much the standard of lipo today, Tumescent Liposuction, you invented that.
Yes.
Is that right?
Yep.
Not just the first guy to do it, but you
I
came up
invented
with
it. I published it.
Tell me
I
about
showed
that.
that it was safe. Well, I started out early on in my practice, very interested in dermatologic surgery, and I took a course in liposuction that showed general anesthesia being used, and there was a lot of bleeding associated with it.
This was in the 80s?
This was in the 80s,
Okay.
early 80s, and there was so much bleeding, I said, oh my God, this isn't for me.
All right,
And
interesting.
Then I thought about it. I have an unusual background that besides my dermatologic training, I've been an NIH fellow in clinical pharmacology. So I started to think about why are we getting so much bleeding and what can we do to stop it? And the first thing I thought of was local anesthesia.
Okay.
And but all the anesthesiologists told me that you couldn't do it because you'd use too much local anesthesia and it would become toxic.
So that's what the Tumescent is?
Well,
this fluid?
The Tumescent is a very dilute form of local anesthesia. So we take one little bottle that is the maximum you can give a patient, but we put it in a big liter bag of saline. And that changes the whole pharmacologic properties. So rather than being absorbed very quickly, it's absorbed over more than 12 to 18 hours. So this means that when you put the local anesthetic in the fat, it stays there.
Okay.
It shrinks all the blood vessels, gets complete anesthesia.
All
so
right.
there's no pain and no bleeding. And it's
Is that right?
It's just like magic.
So you came up with it, and then what?
Well, then I had to very carefully do some research to show that the levels of the anesthetic lidocaine in the blood remain safe, never exceed toxic levels.
Okay.
And so once we established that, it became very popular.
And then you were teaching other doctors?
I teach a course on a regular basis. We usually have 12 doctors come to my office in Surgery Center in San Juan Capistrano.
Is that
We
right?
teach hands-on liposuction, a very intensive course in pharmacology and surgical technique. It's hands-on.
All right.
And over the years, about the last 14 years, we've taught over 700 surgeons.
So lipo, by the way, done properly, I mean, that's a safe procedure. One of the safest procedures?
Tumescent local anesthesia without general anesthesia is very, very safe. As far as I know, there have not been any deaths ever with this.
Is there art to it, by the way?
Lots of art.
A lot of art? I mean, there's
Lots of
technically demand.
skill,
You have to have an
lots
eye
of
for
art.
it, you think?
There's the technical skill or the art of being able to do it, and there's also the aesthetic, knowing how much to do and what not to do, when to overdo it, when you can overdo it, and when you should be very cautious.
All right, what's new, by the way, in the world of liposuction?
Well,
and then we'll get into some of these pictures you brought.
Well, I think everybody's talking about laser liposuction. It's a new method that's been available for about the last 2 to 3 years. It's become very popular, marketed directly to patients. So patients are very interested in it. As a consequence, doctors are very interested in it. But the doctors are still in the learning phase.
Okay.
They haven't really figured out all of the benefits.
You think it's oversold, by the way? Because when I hear it, I talk to doctors about it. And they're making it sound like, this laser goes in, just dissolves and melts the fat, and it just falls right out. And then they suck it right out.
Yeah.
Is that an overstatement?
I think it's an overstatement.
Okay,
Yeah.
okay.
You have to be careful. When you're destroying tissue, you can destroy the right amount or you can destroy too much.
So laser lipo heats it and destroys it? Is that what you're talking
Heats it and
about?
destroys it. Whereas tumescent liposuction goes in, removes the tissue, and there's no damage to the tissue that remains behind it. It's all viable.
So what's the benefit of that?
Well, you heal very quickly.
Okay.
And there's very little discomfort. There's very little inflammation.
Better results, do you think?
I think there's better results.
Because you use a little bit of laser, you say.
I'll say right now there's better results. I do use laser liposuction.
You know, people ask me all the time for referrals. We go out of our way on our website not to refer doctors, you know. But I always say this, and no matter what it is, hip replacement, knee, whatever, go to somebody that this is what they do all the time. Find out, is this their specialty? Most guys, and look, I talk to doctors for a living, do lipo maybe once a month or rarely do it. And so the fact that you do it a lot, I mean, more in a month than probably most guys do in a year, does that make you better, you think? Better results?
I'm very careful not to be burnt out.
Okay.
So I could do many more cases per month than I do.
Right.
I'm happy to do just one a day.
That's good. And that's a lot, though. That's more than anybody I've heard.
I do one a day, and I'm careful with it. And my shoulder doesn't get sore, my elbows don't get sore, and
You're also an athlete, right? I mean, you're a cyclist, so you stay in shape for lipo.
And I have little kids, and I have to be able to wrestle with them.
Okay.
So I can't get hurt. Anyway, I don't like pain any more than anyone else does. And that's part of liposuction, tumescent liposuction. It's actually a relatively painless procedure, and of all the techniques for liposuction, is probably the least painful.
Is it
less painful than general anesthesia?
So what defines, by the way, a great liposuction? Is it just a smooth appearance, high volume of fat? What is it?
It's a happy patient.
Okay.
It doesn't matter. Nothing else matters.
All right.
If you think you've done a great job and the patient's not happy, you haven't achieved much.
Okay.
And so that's the most important thing. So I need to talk to patients and ask them very carefully what it is they want to achieve, and then be very honest with them and tell them, I can do that.
Okay.
And if I can't, I just say, you know what? I don't have the technical skills to achieve what you want me to achieve, therefore I shouldn't be doing this. And
okay, good.
with that statement, I basically eliminate patients who are going to be unhappy. So I just choose the happy patients.
You attract the positive patients. So let's talk about the areas. What are the most common areas of liposuction that you do? And do you call it liposuction, liposculpture?
Liposuction.
You call it liposuction.
Okay. I say tumescent liposuction.
Tumescent liposuction.
Just to emphasize the fact that it's under local anesthesia. We don't use general anesthesia.
Now, when you hear people, when you're out and about, since you invented tumescent liposuction, when you're out and about, do you hear people talk about lipo and you just go, if they only knew the lipo guy is right here. No, I mean, but is it funny when you're out around and you hear lipo?
I hear that, yes. But now it's like everyone assumes that it's bloodless, and it's quick recovery, and the results are great, very smooth results, and that should be standard now. People know that they shouldn't use large cannulas because it causes more irregularities. They know they use micro cannulas, use small holes and small incisions, and leave the incisions open so that there's a lot of drainage. They get a lot of drainage. With that drainage, then the healing process goes very quickly because they've eliminated all that inflammatory fluid that might be left behind if they close those sutures.
Interesting. So with the abdomen, starting there, I mean, is that the #1 procedure?
That's the most popular.
The love handles?
A very close second is the hips and outer thighs.
Okay, like saddlebag area?
Yes.
Okay, so with the abdomen for women, what area? Like in and around the belly button, after pregnancy?
It's typically after pregnancy, and as they're approaching middle age. Okay. Even women who exercise find that they're accumulating some genetically determined accumulation of fat on their abdomen, and they're very slowly beginning to look like their mother. And it's
is that what they tell you?
It's a wake-up call. Yes, they say, "Whoa, this is very reminiscent of someone I know well." And they didn't want to look that way.
So on the consult, what do they say? Okay, so they come in, love handles, abdomen specifically. What do they say to you? I mean, what are their insecurities?
Well, I will usually ask them, what areas bother you the most? And some women will say, right here.
Okay.
Other women will say, well, it's right here. And some women will say, from here to here.
Okay.
So, but you really need to ask them what is their most area of concern. And when we focus on that, we discuss that.
Because they still want to look pretty, obviously. After pregnancy, they want to look sexy and pretty. So you can flatten out that abdomen.
We can certainly make it look a lot better.
Because women wear low pants today, showing that abdomen.
Really, it's not having the perfectly flat abdomen, because sometimes that's not realistic.
Okay.
What we really try to achieve is a very, very significant improvement.